how to take impression or scan in case if margins are very deep and you have to do gingivectomy. You have to make everything clear, clean and visible. Stay tuned, this BG Dental tip is about this topic. Dear friends, dear colleagues, in this episode of BG Dental Tips, we continue topic of retraction. Last time we were speaking about double core technique and tips and tricks related to that topic. If you missed it, you can really go to our playlist in our YouTube and see this episode very easy. But this time we will be speaking about even deeper preps when the margins are super deep, for example, because of the deep caries or teeth that were prepped for some crowns with a deep preparations and so on, and how actually to solve the problems of these depths of preparation, bleeding, exposing the margins, making everything clear and so on and so on. So this is what we are going to discuss right now, but before I will continue, I would like to kindly ask you not to forget to put likes to this video. It's important for us. It's important for the algorithms of YouTube, so many our colleagues will be able to see these videos, these tips and tricks and so on and so on. And also to follow us and to share it with our colleagues, this video with our colleagues, with your colleagues. Okay, so here we can see the very deep margin, distal margin on the upper first premolar. This tooth was prepped for a PFM crown long time ago, and it's time now to make a revision and to do new restorations because the old ones were failed. And this is actually the very interesting and nice picture to show you how deep is the distal margin, because we cannot see where is the finish line and so on. So actually how we do this kind of dentistry, you will be able to see on this video. So we placed the first retraction cord, which was thin, like a 000, and it's still, you see, it's still deep. Then if in such a cases when the gingiva is over the margins, I prefer to use electrosurgery. So I can use, or laser. So we use electrosurgery. It helps you to expose margins better and also to stop bleeding for a while. But then you start to prep. In this case, I did so-called horizontal preparations. We can do vertical preparations in such cases as well, but at that time I did the horizontal preparation with the finish line, and definitely the burr will harm the gum and the gum will start bleeding. To get less bleeding, we have to use electric motor, increasing handpiece, a red diamond burr and a low speed. It will be less bleeding comparing to medium or grit burrs or coarse burrs, and also if you will decide to do this with a turbine. If you will decide to do this with a turbine, it will be catastrophe. Okay, so as you may see in this video, we used electrosurgery 2 times, okay, and then I filled, after I finished the preparation, after I refined the margin, distal margin, I filled this area with hemostatic gel. I use Viscostat Clear from Ultradent, and then I packed the second retraction cord, which is 1 or 2 sizes bigger than the first one. So that will help to keep the gingiva a bit retracted laterally. In some cases, in these scenarios, what we also can do, you can actually soak the cotton roll with the hemostatic gel. For example, imagine you have the cotton pellet, okay, cotton pellet soaked with this hemostatic gel, so it has to be relatively big portion, and then you pack it everywhere. If you have, by the way, temporary restoration, maybe you can also place the temporary restoration before this cotton pellet. You can place it when the second cord is in place. You can place the temporary restoration, which also creates some lateral pressure to the soft tissues. But if you don't have it, you can use cotton pellet soaked with a hemostatic gel. You pack it, so it will create a volume that will press the gingiva a little bit more to the distal or mesial aspect. It's up to the defect zone, and after that you will go for removal of this cotton pellet and also the second retraction cord. So usually it takes 5-6 minutes Okay, so after these 6 minutes, we take this out, we rinse everything, and it will become very dry. Okay, like you can see here in the image. Maybe it's not so visible, but look here. You can see very, very deep margin. Okay, and if you can see that, your intraoral scanner, or if you take impression, so that's one thing. But if for an intraoral scanner, it will be able also to grab this zone, even though it's very deep. The secret of these deep scans is to have a very dry and clear view, and also a very good lateral retraction in these zones. So here you can see intraoral scan, and you can really get a nice view over the finish line, which is here. It's very clear and visible, so that was possible using this electrosurgery, the second retraction cord, the hemostatic gel, the lateral pressure by the cord, and cotton pellet also. And here you can see a video of the scan itself, and you can really understand the difference in level of the gum. So that's the gum level, this is the level of the finish line, so it's, I don't even know, we can measure, but it was more than 2 or 3 even millimeters in such a case. For sure, biologic width was violated, and we need to do a very good fitted provisional restoration to see how the healing will go on, or crown lengthening also may be indicated in such a cases, or if you would like or you have experience in vertical preparations or BOPT preparations, I think this is one of the best case to provide BOPT preparation. That time when I was doing this case, I was not familiar with that technique, but nowadays I would prefer to do BOPT preparation in such deep cases. You can find more videos about BOPT preparations on our YouTube channel, but if you would like to learn about BOPT techniques, preparations, provisional restorations, designing of the soft tissues, we have a very good hands-on course in our academy, BeloGrad Academy. You can go to our webpage, BeloGrad.com. You can see big vertical preparation course, which is 2 days, and you can learn all tips and tricks and principles about vertical preparations, BOPT, and also many stuff related to this kind of periodontally involved teeth and management of these cases using this approach in your daily practice. Hope that was useful. I would like to ask you one more time not to forget to put likes to these videos, to follow us, and to share the videos with your colleagues. Stay strong, and may the dental force be with you.